Hey guys, welcome back to another video. If you have not subscribed, kindly subscribe, share my video, like and comment, and don't forget also to turn your notification bell so that every time I update or upload a video, you will be the first person to be notified. So today's topic, guys, I'm going to talk about syphilis. I had promised that we are going to talk about sexually transmitted diseases, every disease that is under sexually transmitted diseases or STIs. So today's topic is about syphilis, and we are going to look at the signs and symptoms. How can you know that you have syphilis, the stages that syphilis usually develop, and then we are going to look at how it can be prevented and how it can be managed. So make sure you watch this video up to the end, and don't forget to subscribe, like and share. So let's get into the video. So let me define syphilis. Syphilis is a bacterial infection usually spread by sexual contact. The disease starts as a painless source. I said in my previous video, there is a video I did, I said that sexually transmitted diseases are grouped into 5 groups. I said that there are those that causes lower abdominal pain, there are those that causes painless ulcer, there are those that causes painful ulcer, there are those that causes vaginal discharge and rectal discharge, and now syphilis under genital ulcer, and it is under painless ulcer. So syphilis usually present with painless ulcer, and this ulcer usually occurs in the rectum, in the mouth, and in the genitalia. Syphilis spread from person to person via skin contact or mucous membrane with the source. After the initial infection, syphilis bacteria can lie dormant. It can stay there dormant without causing any discomfort, and it can stay there for several years without you noticing. And after staying there, it can reoccur again, or it can be active again. So early symptoms can be cured, sometimes with a single injection of penicillin. So without treatment, syphilis can severely damage some organs in your brain, in your body. And these organs are the heart, the brain, and the organs, even the kidney. And this syphilis can be a life-threatening condition. So if you don't know the signs and symptoms, maybe you can stay with syphilis for several years, and it can cause damage to several organs in your body. So we are going to look at signs and symptoms in stages, because syphilis has 4 stages. So the first signs and symptoms developed in stages, and symptoms vary with each stage. This stage will present with different signs, another stage will present with another different signs. So, but the stage may overlap. The stage, sometimes it can not proceed to the next stage, and symptoms don't always occur in the same order. You may be infected with syphilis and cannot notice any symptoms for years because it has a painless source and it doesn't cause any discomfort. So you can stay there with the source several years and without noticing. So let us look at the stages, and these stages we will see the signs and symptoms in these stages. So the first stage is primary syphilis. The second stage is secondary syphilis. The third stage is latent syphilis, and the fourth stage is tertiary syphilis. So I'm going to start with stage 1, that is primary syphilis. The first stage of syphilis is usually present with a small source, and it is called chancre. That source is usually called chancre. The source appear at the spot where the bacteria enter into your body. Where the bacteria enter into your body is where that source will start form, or will be formed. And let me say, Most people infected with syphilis develop only one chancre. Some people develop several of them in the mouth, in the rectum, in the genitalia. And the chancre usually develop about the 3 weeks. This is in the primary syphilis. It's usually developed in the 3 weeks after the exposure, after you have come into contact with the source. It will develop after 3 weeks, 2 to 3 weeks. So many people who have syphilis don't notice the chancre because it is usually painless, and it may be hidden within the vagina or in the rectum. It is not always on an open place. I mean, it is not on top of the vagina or just on the skin where you will see. It can hide inside the vagina, where sometimes it will be difficult for you to notice. That is why you may be not even seek medical attention at the right time. And this chancre, it will heal on its own after 6 weeks. Yeah, it's usually heal on its own after 6 weeks, and then you will not feel anything, you will not notice anything. And then if it is not treated, it proceeds to the second stage, that is secondary syphilis. Within a few weeks of the original chancre healing, after the healing of the chancre, you may experience a rash that begin on the trunk, on the body, on the abdomen, on the back, but eventually cover your entire body. And sometimes these rashes can spread on the palm, on the toes, on the sole, on the feet. Yeah. These rashes is usually not itchy and may be accompanied by wart-like sores in the mouth or in the genitalia. So if you see a person is having a wart in the genitalia or in the mouth, maybe you can query syphilis. So you can test this person for syphilis, or you do other lab investigation to see the cause of this genital wart. Some people also experience muscle aches in this stage too, fever, sore throat, and swollen lymph node. These signs and symptoms may disappear within few weeks or repeatedly come and go. They can usually come and go. They come after sometimes they go. So maybe if you are not careful, you can be treating some rashes that you don't know that you are having syphilis. So because some people they don't cause any discomfort, and sometimes it is hard for a lay person to notice or to know that these things are whatever he is experiencing or she is experiencing syphilis. The person will not seek treatment, and the syphilis will proceed or will progress to the third stage, that is the latent stage. So if you are not treated for syphilis, the disease moves from the secondary to latent stage. When you have no symptoms, and this stage usually doesn't have no symptoms, and you can stay in this stage for several years. Signs and symptoms may never return. It is only the first stage and second stage that we have the signs, and the third stage you don't have the signs, and the disease will progress. If not treated, the disease will progress to stage 4, the late stage or the latent stage, and this is the signs will show. Maybe this stage will come after maybe 15 to 30 years. That is why I said syphilis can stay in your body for decades. So on this late stage, the disease may damage the brain, the nerves, the eyes, everywhere in your body, and the blood vessels. This problem may occur years, and if not treated, you can die, or it can cause complications. Yeah. So we also have what is called congenital syphilis, And congenital syphilis are babies born with women who have syphilis, and that is why when you come to the hospital when you are pregnant, you have to be tested for syphilis, because syphilis usually causes a lot of damage if you give birth to a baby when you are not treated when you are pregnant. So syphilis can become infected through, the babies can get infected. Babies can get infected through placenta and maybe during birth. So most newborn with congenital syphilis have no symptoms, because this syphilis usually it doesn't cause any discomfort. It usually present with no symptoms sometimes. Although some experience rashes, some babies may experience rashes on the palm, on their hands, and on the sole of their feet. Later, symptoms may include deafness. You may just find that your baby is not able to see, and also maybe the baby will have teeth deformities, and maybe the bridges on the nose, and maybe the nose can collapse, and this will cause damage, or the baby can die. I was saying before I got distraction that who is at risk of getting syphilis? Those who are at risk of getting syphilis are the following people: those who engage in unprotected sex with the people they don't know their status, those who have sex with multiple partners, men who have sex with men, those who are infected with HIV, because they are correlated, and also if you have an history of infection with syphilis. If you're somebody who maybe had syphilis before, you can get infected. So what are the complications of syphilis? Without treatment, syphilis can lead to damage throughout your body. Every part of your body can be damaged by syphilis. Syphilis also increase the risk of HIV infection, and for women can cause problem during pregnancy and also during birth. Treatment can help prevent future damage that cannot be repaired or reversed. So if this damage has already occurred, sometimes there cannot be reversed. So treatment can prevent this future damage. So we have the tumors. Syphilis can cause tumors called gammas. In the late stage, there is gammas. So these gammas, these tumors, they are called gammas. This bump can develop on the skin, on the bone, on the liver, or any other organ in the body. Gamma usually disappear after treatment with antibiotics. That is maybe the good thing about it, but it can cause some tumors. You know, if you have a tumor, you are at risk of getting cancer. So that is one of the complications. So we have some of the neurological complication, and syphilis can cause a number of problems with your nervous system, and these include you can get stroke, you can get meningitis, and then you can get deafness, you can get visual problem, you can get dementia. Yeah, those are some of the neurological problems that syphilis can cause. So cardiovascular problem, this may include maybe you can get aneurysm and inflammation of the aorta in your body, and also syphilis can damage the blood vessels and maybe the heart valves. And then also we can the next complication is about HIV infection. If you have syphilis, you can easily get infected with HIV infection. And also the third complication is about childbirth. It can cause permanent infertility if it damages the ovaries or if it damages the testes. It can cause permanent infertility to both men and women. So how do we diagnose and how do we treat syphilis? Syphilis can be diagnosed by testing a sample of blood. You can take the fluid from the source, and then you can also take the fluid from the cerebrospinal fluid, that you can do a lumbar puncture, and then because it can cause meningitis, it can cause a lot of problems. So you can take the fluid from the cerebrospinal fluid and see if the disease is in the brain or it has already infected the brain. And also I've said you can take the fluid from the infected source or the source and maybe the blood. So what are the treatment? If I talk about the treatment, I'm not speaking about this so that somebody can go and buy these drugs from a pharmacy, or they can prescribe by themselves, so that they mostly I'm not doing that so that you can go and prescribe yourself. If you have syphilis, just make sure you go and see the doctor. So when diagnosed and treated in early stages, syphilis it doesn't reoccur. If it is treated in early stages, it does not reoccur. And if it is treated in late stages, sometimes it can reoccur. So a single dose of penicillin can stop the disease from progressing to other stages. Penicillin is the only recommended treatment for pregnant women with syphilis. Women who are allergic to penicillin can undergo desensitization process, then may allow them to take, after desensitization process, they can be allowed to take penicillin so that they can have a healthy baby at the end. So syphilis, if you have syphilis and it's not treated, it can damage the baby and it can damage also the pregnancy. You can have miscarriage, you can have stillbirth, or you can have the baby, or you can give birth to a baby who is blind, who is having congenital problem, who is having problem with the teeth, and many other things. So I think I've exhausted everything, and therefore maybe let me talk about how it can be prevented and to stop spreading. First thing, we encourage people to be faithful to one another, and also maybe you should have monogamous relationship. You have one partner, both of you just be faithful to one another, and you have one partner. And then you should use, if you have to have sex with the person you don't know the status, you should use condom. Yeah, you should use condom. And also you can abstain. I think those are most important about syphilis, how it can be prevented from spreading from one person to another. So I think we have come to the end of our video, the third episode or the third section of STI. So if you are watching this video for the first time, kindly subscribe, and let's meet in my next video. Bye.